Any reopening of the state economy depends heavily on what happens with hotels and restaurants, along with casinos. Barring a vaccine for the coronavirus, it's expected there will have to be measures to protect the health and safety of customers and workers. That's why the union representing those workers, Unite Here Local 26, has come out with guidelines for reopening. To tell us what that should mean is the local's president, Carlos Aramayo. Thank you very much for being with us, Carlos.
Thank you.
Carl, start with the immediate situation. You have a lot of members of this union who are out of work right now, maybe worried about getting health insurance. How does that look?
Yeah, so we have by our estimate, about 97% of our members, of our 12,000 members, are currently laid off. The very small number of workers who are at work are working at the airport and the airline catering facility at the Boston Hope Hospital, and a very small number of cafeterias at universities that are open to serve the handful of students who couldn't get home, and a couple small hotels. And so we've been focused on several things since all of this began. Number one is we wanted to make sure that no one lost their health care during a health crisis. Obviously, we understand the pandemic is obviously a health crisis. And it's a medical crisis for the entire society. And we wanted to make sure that our members are taken care of. And so we have extended the union trust health benefits, have been extended through the summer for our members. And then for folks who are on their employer health cares, we've been trying to work with employers to extend those healthcare benefits as much as possible. And finally, frankly, for people who are in our union and are out of our union, we're currently lobbying in Washington around CARES 2 to try to get an extension of COBRA for people covered by the government, and trying to make sure that really nobody gets knocked off healthcare. And hopefully we can get that done in the next stimulus bill. So that's been our first priority. Our second priority has been obviously income. We don't want to have people having an undue burden in terms of losing income. And we have worked with some employers to extend payroll, even though they're closed. A number of employers, the Encore Casino, Harvard, MIT, Tufts, have chosen to extend payroll. That's been very welcome. And then we have been working to make sure all of our members get on unemployment. And we have a hotline that's working all day, every day, to try to facilitate getting our members actually to get on unemployment. The third priority we laid out is about health and safety, workplace health and safety. It's something we're thinking a lot about right now. Sadly, this virus is something that has affected our members in profound ways. We've had dozens of members fall sick and be hospitalized. We've had 2 members pass away. And we even had a minor outbreak at our Sky Chefs facility at the airport, where they prepare food to go on airplanes. And so we've been focused on trying to put together guidelines where we're putting together, talking to a lot of experts, a lot of medical experts, a lot of scientists, a lot of public health experts, occupational health experts, to really try to think about how our industries can really be safe for our members, but frankly also for the customers. It's a customer-facing industry, and at the end of the day, we really believe that we need to have a safe workplace and a healthy workplace if we're really going to begin to open up this industry again.
Well, we're already hearing from employers, at least, that workplaces can be exposed to community spread. But on the other hand, way back in February, which seems like a long time ago, a hotel in Boston was actually a hotspot for spreading this virus, the Marriott Long Wharf. What are the lessons from that?
That's right. The Biogen conference, unfortunately, has become a national story in terms of how the virus can actually be spread through these kind of high density events. And one of the things that we feel very strongly is that when we think about reopening and we think about going back to work and we think about the industry returning, that there really needs to be some regulatory guidance from the state and from the city. At the end of the day, I think the virus is developing so quickly. The thinking on the virus is developing so quickly that even with the best intentions, it's very difficult to adjust on a day-to-day basis to the health and safety practices that need to be put in place. First of all, we agree with the governor that without testing and contact tracing, it is very difficult to reopen industries like our own. And also, we feel that once these industries do reopen, that state and local governments need to look at these industries, need to look at ways to ensure social distancing, ensure that PPE is handed out where required, and to ensure that if there is an outbreak, it is dealt with very, very quickly. And frankly, I think this really does benefit the whole industry. We know that there are some actors who are going to do a really good job. We've already been in discussions with Encore, with Marriott, who are large actors in our industries, who have very good thinking about this. But at the end of the day, as you saw with the Biogen conference, one problem will affect the entire industry. And so that's why we're looking to the state and to local government to enact health and safety regulations that will well, you can't guarantee, but will certainly make our industry as safe as possible given the circumstances.
I see here an industry that's probably going to be in low gear for a while, but at the same time, we're hearing all this talk about the need for a lot more testing. How do you make those two things work together?
Yeah, I mean, I think it will be difficult to move. So our industry thrives, especially both the hotel industry and frankly, university food service. They thrive in environments where a lot of people get together in one place to go to an event, whether that's going to your dining hall to eat food when you're on campus, or whether that's going to a conference where folks have flown from all over the country or internationally to attend a conference. And all of our industries do very well in circumstances that are the exact circumstances that can lead to the spread of the virus. And frankly, the success of our industry is really very much driven by those kind of events. So I really do feel that unless we can get ahead on testing and contact tracing, it will be difficult to return to the scale that we had before this crisis hit us, right? All of our industries were booming until the beginning of March. And I think everyone was looking forward to a very, very successful season here in Boston, in the Boston area. But until we can have adequate testing of employees and frankly of the general population and some process to contact trace, I think it will be very difficult to have, I think there will be some travel, right? There currently is some need for some hotels. I think to have the kind of events that drive occupancy and the business in our industry will be very challenging. And then even with that, there is going to need to be health and safety protocols.
I'm pretty sure you have a lot of members who are desperate to go back to work, but there are also among them people who are going to be reluctant. They might have an older relative at home and they might feel that they're uncomfortable with going back. What should be done for them?
That's right. I mean, this has been one of the challenges that we've faced. We have obviously workers who pride themselves on the service that they provide, and they want to get back out there. They want to be able to earn a living, and they want to be able to welcome people to the city as they've done for decades. But also we have workers who themselves have pre-existing conditions that are real comorbidities for the virus, or are living in multi-generational households with elderly who have comorbidities for the virus. And so one of the things that we have actually successfully done with a number of our properties that are open right now is that we've worked on volunteer scheduling, where individuals can volunteer to go to work or not to go to work, but not lose their place of employment in the future. And that's a principle that we've put out on our guidelines. And we have been able to do that successfully at the various universities that are open, the hotels that are open, and at the convention center. And it's a model that we're going to hold on to for quite some time until the sort of severe moment of this crisis has passed.
Well, one thing we're paying a lot more attention to right now is the difference between guidelines and regulations, especially reflecting on what happened with the response to the outbreak at the Marriott Long Wharf Hotel, by the hotel itself. How do you come down on that? I mean, how far do we need to go with real regulations as opposed to letting the industry just follow some guidelines?
So we strongly believe that the industry cannot regulate itself, and frankly, that any industry can't regulate itself because of the way this virus has developed, and obviously how quickly it can spread. So we have released a set of recommendations for the kind of regulations that we think would make sense, and I'll just throw a couple of examples out there. We think there need to be specialized teams in the public areas of properties to continually clean and sanitize high touch areas. We think that those areas should be reduced as much as possible, either through technology or through the use of things that you've seen in some grocery stores, plexiglass being installed and things like that. We think that hotel rooms need to be cleaned to a much higher standard than they have typically been cleaned. There are new products on the market that are attempts to directly deal with the coronavirus, and we think that those need to be used across the board in the industry. We know that will make it more difficult to clean rooms, and so we're also calling on the industry to reduce the room quotas for room attendants who have to clean to that standard. We think that that in the restaurants and in industrial food service, there need to be changes to the way scheduling is worked in shifts and in teams to reduce a crowded nature of the kitchen. And certainly in those areas, we think that there needs to be medical grade PPE because you're not going to, in some of these kitchens, not all of them, it's going to be very difficult to maintain a 6-foot separation between individuals. And so, and I can get into a lot more of the weeds. I'm not sure how much your viewers would want to see all of that, but I do think it's very important that, you know, those are pretty high standards for how a company would need to operate. And as I said, you know, companies like the Encore, companies like Marriott have similar thinking that we do, but we do think it needs to be applied across the board, which is really to protect the industry. And we want to make Boston a clean and safe place for visitors to come to. And we think that regulations from the state and from the city are the way to do that.